Clip demonstrates healthcare unique bidirectional medical information flow. It is the core capability to realizing care collaboration model outlined by the Central Medicare and Medicaid Services. Let's walk through the scenario. A patient registers for chronic care management services with a primary care provider. We'll walk through major components making up the CCM care plan documentation. Primary care provider logged into Zotic Provision Control Center. The control center is designed to streamline process for CCM services support. It is cloud deployed and integrated with the care provider EHR system. Let's pull up the CCM care plan for patient Nancy Cassidy. The control center is retrieving patient medical information from the EHR system. It does not duplicate data from EHR system. Nancy Cassidy has 3 chronic conditions: hypertension, diabetes, and asthma. For each of the chronic conditions, CCM care plan documents the stage of the condition, behavioral recommendations such as lifestyle and diet for treatment, and symptoms to be monitored by care staff to anticipate patient medical condition change. Stage reflects the status. Lifestyle and diet are recommended behavior change. The monitored symptoms are potential indication for worsening conditions, potential development into other conditions, and/or potential medication reaction. Primary care provider can modify the CCM care plan. Changes are immediately available upon request by other care provider. Let's see how easy it can be done. CCM care document is the communication vehicle to convey primary care providers' plan to treat the patients. It is also a staff delegation vehicle to anticipate patient medical condition change and alert primary care provider. Switch here to see how secure, ease of use the other care provider would be to retrieve CCM care plan, collaborate with primary care providers. CMS requires a 7x24 access to the CCM care plans. How Zotic Provision CCM would providing such capability through electronic format without requiring human interventions such as call center, in a secure manner with patient consents, and no additional trainings or hardware needed for any other care provider. First of all, there is going to be a common URL to gain access to the CCM care plan. Care provider will require to give their credential via secure login. Additional security layer is added on confirming care provider by sending them a one-time security 4-digit code to their mobile device. After care provider's validation, the system requires another 4-digit code sent to the patient mobile devices. The patient would give the 4-digit code to care provider as a form of patient consent to access the CCM care plan. Please note, the patient consent is for the patient's CCM care plan only, and not only for the other patients. It is also a one-time secure token. Past the security layers, the CCM access point is retrieving the CCM care documentation on demand and near time from the primary care provider control center. no human interventions, highly secure, most up-to-date patient medical information, no additional hardware or healthcare IT investment. Those are Zotic Provision's CCM advantage. Solution unique is our ability to close the loop with the bidirectional information flow design. Other care providers can upload the patient visit summary, provide comments, and input to a primary care provider from their specialist standpoint. Better yet, you will also witness the primary care provider get the attention when it's needed, instead of looking for information or rely on the patient to convey the situation. Both will add to the primary care provider's scalability and care outcome efficiency. An email is sent from the system to the primary care provider informing about an action is required and placed on his or her to-do list relating to patient Nancy Cassidy. Left corner of the primary care provider control center is the to-do list. The visit summary from Dr. Donald Walls is placed on the priority 1 requiring Dr. Tan Tran's attention. Here it is. The primary care provider can retrieve the visit summary, review the latest patient medical condition change report by other care providers. Action can be taken and updated the patient CCM care plan. Note that on the right-hand side of patient Nancy Cassidy care plan, there is a list of visit summaries from other care providers, including the primary care provider staff. It presents the full care spectrum of interaction and collaboration between the primary care provider and other care providers.